embolism syndrome. So fat embolism syndrome means that the fat has entered the blood and it's circulating in the blood. So what are the causes of fat embolism syndrome? So the causes of fat embolism syndrome include fracture of the bones that are rich in marrow, so enriched in marrow and fat. And so these bones include, for example, femur and also the pelvis. The pelvic bones are rich in marrow and fat, and the femur is also rich in fat. And another kind of uncommon cause is pancreatitis, and we know that pancreatitis, there is necrosis of the peripancreatic fat, and that fat can also embolize and result in fat embolism syndrome. Let's then talk about the clinical presentation. So the clinical presentation is really important in fat embolism syndrome because it is mainly a diagnosis of clinical presentation. So you see what the patient presents clinically, and from that you kind of make the diagnosis of fat embolism syndrome. So the clinical presentation occur about 1 to 3 days after the event. So it takes about 1 to 3 days for the clinical presentation to occur, and it presents classically with a clinical triad of respiratory insufficiency, rash, and a neurologic dysfunction. So now let's explain this clinical presentation. So now let's say we have this bone, and let's say this is a femur, and then a person kind of meets an accident, a road traffic accident, and this bone is kind of fractured. And when this bone is fractured and it is like moved around, because the people don't usually know that that moving the bone around can result in fat embolism syndrome. So now the bone is moved around and the fat kind of enters the blood, in the venous blood, and then the venous blood, we know, goes to the venous blood goes to the all the venous blood goes to the heart. So if this is let's say the inferior vena cava, and the blood has entered the right heart, and from the right ventricle the blood enters the lungs. So now the first organ that the fat emboli are gonna encounter is the lung. And so that is why the lungs is commonly affected, because it is the first organ that is affected. And the reason for that is because all of the venous blood enters the heart, and from the heart the blood goes to the lung. So if this is the fat emboli here, they can occlude the vessels in the lung, and that will result in symptoms of respiratory distress, for example difficulty breathing, and also hypoxemia. So it can result in hypoxemia. And then so for that, in a treatment, we're going to talk about the treatment mainly supportive. And so treatment for hypoxemia is to give oxygen. The second organ that is affected is the heart, and so from the lungs the blood will come to the left heart, and from the left ventricle the blood is going to go to the brain, for example, brain or systemic circulation. So in the brain, if the emboli occur here, it can result in neurologic dysfunction and neurologic symptoms, for example, confusion. So that's the second presentation. Now the third presentation is that the blood can go to the skin. So if this is the skin and the emboli are here, and then blood can come here, then it can result in petechial rash. So this is the classic triad that the patient with fat embolism syndrome, most patients recover fully and within a matter of days. And treatment is supportive. For example, if there is respiratory distress, then you can give oxygen. So it really is just supportive treatment, and most patient will just recover fully after supportive treatment. Then it can actually require up to the level of like mechanical ventilation too. So just give the patient the supportive treatment, give treatment according to what the patient requires. So then we have the prevention. So the way to prevent it is early immobilization of the fracture. So when the fracture is not moved around, it can help prevent the fat embolism. So it will prevent the fat from entering, or the marrow from entering the bone. So